Welcome to a Business Minute with Lily Lopez, presented by the South Florida Hispanic Chamber of Commerce. Today, we are very honored to have Carlos Migoya, the President and CEO of Jackson Health System. I've known Carlos for a long time, and I always tell him, Mr. Migoya, he says, Carlos, please. So that's really nice of him, and we appreciate it. And my hat off to you for all the great work that you've done in dealing with this pandemic. So I wanted to read a little bit about you before. I know that everybody knows you more or less, but I wanted just to say a few things about you. You served as president. You have been serving as president and CEO of Jackson Health System since 2011, overseeing one of the nation's largest and most respected public healthcare systems. Jackson has had the distinction of bringing a world-class medical care, including the medical school facility, the students of the University of Miami, FIU, to taxpayer-owned system that guarantees a single high standard of care for all residents of Miami-Dade County. I know that Jackson, my father was there in Jackson one time. He was assaulted and he had a hematoma in the brain. And I remember that my mother would always say, we grew up knowing about Jackson, about the service, about the care. And I remember as a very young lady going there and seeing my father and the care that they provided to him. And it was just extraordinary. And you've taken it to new heights. So Carlos, thank you. Thank you so very much for the hard work, for everything that you're doing, and for your very valuable time and to meet with us and to be able to talk to the members of the chamber. So take me through just a brief overview of what it's been like for you when this pandemic hit in March, and how you were able to not only lead the staff and the healthcare professionals at Jackson, while at the same time you had to deal with the media, with government, with elected officials, everyone pulling and asking questions that really had no answers and with no possible solutions. So how were you able to manage all of that?
Well, we've been at it now for 10 months. It's been a very difficult time since early March when we started hearing about the pandemic here in South Florida. So it's been really a challenge for all of us. It's been very, very stressful for our frontline healthcare workers that deal with these patients on a regular basis. I will tell you that one positive thing is that we have learned a lot on how to deal with the disease. So for that reason, our outcomes are a lot better than they used to be. So we're doing better. Now, obviously, we get a whole new front, which is the vaccine, and how to try to get the vaccine to as many people as possible in the community while we have a limited supply of it, of course.
And what has been the biggest challenge now that you have the vaccine? And I know I saw that there were huge lines and just people waiting, and you ran out, but I know it's happening everywhere. So what is the biggest concern that you have now with regard to the vaccine and the possibility of being able to deliver so much to those who are the seniors and the people who have the pre-existing conditions? How do you see that happening?
Well, we really haven't had huge lines because one of the first things we did is we created an online system in which people can get their own appointments.
Right.
By doing that, we've been able to provide the vaccine to any of those people that we have appointments. We were lucky enough to receive about 14,000 doses a few days ago. So for that reason, we were able to schedule 7 days at 2,000 vaccinations a day. Okay. So we've been able to do that. And I will tell you that we have had many people. And as I walk those lines, not one person complains, which is hard to believe in Miami.
Oh, wow, that's wonderful.
Okay. And everybody's really happy. And one gentleman that his appointment was at 7 o'clock in the morning, but he decided to show up an hour earlier. I don't know why. And when we apologized to him for having to wait, he says, "Don't worry, it's like winning the lotto. I'm just excited to be here." So everybody's got a really good attitude. Our employees have a good attitude because of the impact that we're making to the community. But right. Of course, when you think about the fact that the number of people we have in our community, the fact that we can only do 2,000 a day, we got a long way to go.
So that's what you're doing, 2,000 a day. Yes. Do you anticipate that number of vaccines will increase in the coming weeks?
Yes. The goal, what we're trying to do is, besides what Jackson is doing, today or tomorrow, I believe Hard Rock Stadium is going to be opening up to be able to do drive-through vaccinations. The county is also looking to open up on the west side of town. We're looking to open up at Marlin Stadium as well. So we're hoping to have 3 drive-throughs. In addition to that, what we're doing is we're taking a lot of the HMOs that deal with Medicare patients and have them the ability to vaccinate. 70% of all the members of Medicare in Miami-Dade County work through an HMO, so therefore getting them to vaccinate those patients is important. So what we're trying to do is spread as much as we can to get as many people to vaccinate. We believe that we can get to people over 65, the majority of them, the ones that want it, of course, vaccinated by the end of January, maybe first week of February, and then go on to the next group of people.
And that with the seniors? pre-existing conditions. And then the next group would be, you anticipate maybe like February or March?
The idea of the next group, and this is obviously a directive we're getting from the state and the governor, would be to take the younger people that have high risk immunity issues, all kinds of different things. We believe that that will also take another month, and we think we'll get to the masses, to the regular population by March. And the goal is if we do 75,000 a week, like we're projecting probably in the next couple of weeks, that we can get to 1.2 million people by the end of April, early May, and that would be about 40% of the population, it's really the target we have at this point.
That's great. I have a question because I know there are people that are concerned about the vaccine. You know that always happens. I mean, with all types, like with the flu, some people say I never get the flu shot. I always do personally get the flu shot, and but I know there's a lot of concern with the vaccine in general. What do you hear? What do you see? I know, of course, I mean, one of the best hospitals in the United States, and it's the Pfizer, right? The vaccine, the Pfizer. But what have you heard? There's concerns, right? I've read that there's a lot of concerns.
Well,
what can you say? What message to our Hispanic?
Our vaccine is the Pfizer, which is the one that takes a special equipment because it has to be maintained at 70 below zero. Right. The other one, of course, is Moderna at this point in time, which is actually just at a freezer level. I will tell you that what we've seen, we've vaccinated thousands and thousands of people, and the reaction has been very, very minor. And obviously, in every case, what everyone is doing is when they get vaccinated, we want to make sure that we keep them between 15 and 30 minutes, depending on the issues that patient may have. But we have seen very minor reactions at this point in time, and we're hopeful that we're going to be able to continue that way. So we're already at the second doses for our employees. And as far as the community is concerned, we'll start on January 24th with the second doses for the community.
So what you've seen is more like the flu, like a little bit of you feel tender and that type of reaction you've seen. Have you seen that or not even?
Obviously, the more common thing is to have a sore arm from the injection for about a day or so, and then some people have had a little more, depending on the allergies or something, may have had a little more of a reaction. But frankly, the moment we've seen those kind of reactions, that's the value of getting vaccinated, whether it's either fire rescue or at a hospital. We've been able to give them Benadryl, and within 5 minutes or so, they've done fine. So there really have been very, very minor results from any vaccines.
And basically, that this is a new sort of like, if you will, technology. The vaccine. It's not like the common vaccine that they use a little bit of a virus. So there's something completely new. So you feel confident. So we could say to our members and to the community, anybody who's going to see this show, that we're confident that it's safe and we will want people to take the vaccine. Basically, that's the message we will want to give out to.
I would tell you right now, we have done 10,000 vaccines. And what I've just told you about the minor symptoms is what we've seen in those 10,000. We have not seen any major reactions yet on those 10,000. Obviously, it's a new vaccine, so I can't really speculate as to what will happen. But I can only tell you about the 10,000 that we've already vaccinated.
Exactly. Okay, well, that's great. I'm very happy. So, Carlos, anything you would like to add? Because I know you're so busy.
We're kind of busy, and obviously, as positive as all that is, obviously there's still a lot of people out there who would like to get vaccinated. We want everybody to be patient. I want to make sure that we will get to everybody, and we hope to be able to get to as many people as possible in the next 4 months in our community, so that we can try and slow down this pandemic as best we can.
Exactly. Thank you so very much, Carlos, for your time and for being on a Business Minute with Lily Lopez. I really appreciate it, and I know that our members are very appreciative of everything that you do for us in the community. Thank you.
Thanks, Lily.
This is Yendi for 90 Seconds of Tech, and today we're going to talk about how you can save money on your prescriptions and at the same time help the South Florida Hispanic Chamber of Commerce Foundation raise funds for 2021. The South Florida Hispanic Chamber of Commerce Foundation is a 501c3 not-for-profit organization that provides opportunities to financially disadvantaged minority students. We provide scholarships, internships, and other opportunities in community building and education enhancement programs. This year, we're excited to partner with Clever RX, an app that helps you save money on your prescriptions at no cost to you and at the same time raise funds for the South Florida Hispanic Chamber Foundation. Let me show you how. Go visit cleverrx.com/ SFLHCC. Download that app into your phone, and as soon as you start using that app, we start raising funds for the foundation. Search for your prescription. Find results for the lowest price closest to you and or your preferred pharmacy. Show your in-app voucher or use your Clever RX physical card at the pharmacy and save big on all your prescription needs. Clever RX is accepted in over 80,000 pharmacies in the United States, including the big ones, Walgreens, CVS, Walmart. So this is how you can save. 40% of all prescriptions using the Clever RX app come out to about $10 or less. You get a discount on over 55,000 FDA-approved medications, and Clever RX beats Good RX almost 60% of the time. So help us out this year. Download the Clever RX app at cleverrx.com/SFLHCC and start saving money on your prescriptions, and at the same time, do something good for your community. This is Yendi for 90 Seconds of Tech, reminding you that giving to the community is also healthy.